morning, good afternoon, and good evening from wherever you are joining us around the world. Today we will be having a conversation on the future of strengthening health systems across the African continent, looking beyond the COVID-19 pandemic. My name is Sarah Jerving. I am a senior reporter with DevX, and I'm honored to serve as the moderator for today's event. Today I'm joined by an exceptional lineup of public health experts, which I look forward to engaging with. COVID-19 reminded the world of the importance of healthcare, of strong health systems, a well-trained workforce, and why we need to be prepared to respond to health emergencies at their onset in order to minimize their impact. Although many African countries responded quickly and effectively to the pandemic, there have been no shortages of challenges over the past few years. Many essential health services were interrupted. Limited access to COVID-19 vaccines highlighted long-standing, deeply ingrained inequities globally, and for the first time in the last 2 decades, countries have seen setbacks in the fight against HIV, TB, and malaria. But against this backdrop, we've also seen unprecedented acts of solidarity, partnership, and innovation in response to the pandemic across African countries. Today, as many countries are shifting from crisis response to long-term control of COVID-19, it is vital to integrate COVID-19 management into broader health systems and leverage lessons learned from the pandemic as well as new investments and innovations to advance health systems more broadly. In our conversation today, we want to highlight some of the most pressing health issues of our time and to hear from these experts on the challenges and opportunities that will shape the future of health in Africa. Today's event will begin with a fireside chat, followed by a panel discussion. Please feel free to add any questions that you might have in the chat box, and we'll try to get to as many as we can with the limited amount of time that we have. And with that, let's begin our discussion. I'd like to welcome Dr. Ahmed Agwal Ouma, the Acting Director of the Africa CDC, for our Fireside Chat. Dr. Ouma, thank you so much for joining us today. Africa CDC has played a key role in supporting countries during the pandemic and leading the continental response. As many countries shift from crisis response to a long-term control strategy, what can they do to integrate COVID-19 control into their broader health systems and leverage the pandemic response to strengthen basic services more broadly?
Thanks, Sarah. And this is a very good opportunity for us to share some of our thoughts with participants and the rest of the world. And it's a good place to begin. Beyond COVID-19, how do we transition from where we are now into a new longer-term handling of this SARS-CoV-2, the COVID-19 virus? So one is we need to use what we have to address the long-term goals of keeping this particular transmission as low as possible in the community. That means our health systems, the way we know them today, need to be strengthened so that it is able to identify quickly those that have the virus and manage their situation as fast as possible. That means we need to ensure that we are ready to do testing. We need to be sure that we are ready to be able to isolate and manage. And we need to be sure that we are ready to provide information regularly to members of the public so that they're more prepared to respond to any surge in infection. So this is one, using what we have. Second is using the lessons that we have learned during this pandemic to improve the way in which we addressed particularly adult immunization. Because most of the vaccines we have out there are for children, the regular ones, but here is a situation where we want to immunize a very large proportion of adults within each and every community. And adults are by and large very busy people looking for ways of earning a living. So how do we take the lessons of COVID pandemic and strengthen that arm that addresses adults in a collective manner? not them coming one or two, but then if we need to address the issue of vaccination to adults together, then we need to strengthen that part. That's a lesson that we have learned, and it means that we need to fix how we reach adults quickly and how we engage with them to be able to accept interventions like vaccination on the continent. And finally, it is very important that we, as we transition, we ensure that the stigma associated with COVID, the difficulty of those who have COVID accessing healthcare is addressed. So you address the stigma, you ensure there is a safe space within the healthcare system that our adults can be able to access the treatment or vaccines, and finally make sure that our health workers are ready, prepared, not just with knowledge, but also with tools that can be able to protect them from very highly infectious diseases like COVID-19.
And you've championed a vision for the African continent for the future, which includes strong public health institutions, local vaccine manufacturing at a broad scale, and robust health security programs that are led by African countries. How can the continent achieve this vision? How can healthcare remain a priority across African countries beyond the pandemic?
One big lesson we've learned with this pandemic is that healthcare matters. It is not one of those services that governments and the private sector give to the public. When push comes to shove, nothing functions if healthcare, the healthcare space has not been well taken care of, particularly in a situation like this. So we need to ensure that we don't lose the lesson. Let's not waste this pandemic. Healthcare matters. So how do we invest in the healthcare system in a way that does not allow for the same kind of disruption to happen into the future? So that investment means that we need to work across sectors, because each and every sector brings either something positive or something negative to the health space. And whenever each sector fails, it becomes a public health problem. It doesn't matter which one. If our health security, if security forces don't do their work, it becomes a public health problem. Water, sanitation, nutrition, doesn't matter. If it fails, it becomes a public health problem. So the health sector should be seen as an investment, and so governments need to put in a little bit more than they're doing right now in ensuring that we have a system that will not collapse under a future pandemic. So the vision of a strong public health environment on the continent, what we in Africa Union, Africa CDC call the new public health order, demands that we invest in certain areas much more than we are doing now. Stronger institutions, a health workforce to be in the right numbers and deployed to the right places, given the right tools, local manufacturing, appropriate partnerships that are action-oriented and are going to be based on priorities of Africa, and then domestic resources, whether it is money or expertise or whatever it is that we need in terms of preparedness and response. How do we achieve the vision? Three things are important. One is political buy-in, and on the continent we have this. Our heads of states have pronounced themselves very clearly. Our ministers have pronounced themselves very clearly as technical people, and those of us who want to invest in the public health space, we have political commitment. The second is actual action that is geared towards implementing the new public health order. It means that at national level, our governments now need to put in place infrastructure or an ecosystem that delivers on these 5 pillars of the new public health order. And third, we need for those institutions that we have strengthened to work. Africa CDC needs to provide it with the space to work. Africa Medicines Agency needs to be provided with the space to work. Indeed, the Africa Union needs to be provided with the space to work. And we can only be able to do it if we take the regional approach. That Africa comes first, and then we can be able to include others in the conversation around how do we strengthen our health security. If we do that, basing on the political commitment that we have, and then using the strengthened institutions both at continental and national level to deliver, and providing them with the tools and resources that they need, we will achieve the vision of a new public health order.
And so the African Union and Africa CDC have set a target for the African continent to locally manufacture 60% of vaccines that are used locally by 2040. What is needed to reach this goal, and what kind of challenges do you think lie ahead?
Let me start with the challenges, and then we can be able to double back onto what we need to do. Two very big challenges exist. One is the infrastructure that is required to be able to manufacture vaccines, human vaccines on the continent. And I don't just mean the buildings, those are easy to put together, but it is the technology that is required and the technical know-how that we need to be able to ensure manufacturing on the continent. This is one thing. Second big thing is intellectual property. R&D, research and development, is going on globally. Very little of it is happening on the continent. So it means someone else owns that product which we would like to be part of the 60% that we are manufacturing on the continent. So these are the two big challenges that we face in as far as getting to that ambition of manufacturing 60% of human vaccines that we use here on the continent. What do we need to do? Three big things. One is we begin with human capital development. If you don't have the right people who know the right things, you can't be able to start any manufacturing. And as Africa CDC, through the Partnership for African Vaccines Manufacturing, this is the key objective that we feel we must be able to begin with. Train people in all aspects of R&D for vaccines, in all aspects of manufacturing, in all aspects of maintaining the facilities that you're going to need to be able to manufacture. This is one. Second is to secure the market. If you manufacture and you don't have a market, then you can't be able to justify the investment. And securing the market, we are doing that in two different ways. One is through the Africa Continental Free Trade Area. That's a treaty that is already in place. Systems are being put in place to ensure that Africa can trade with itself first before trading with outside of Africa. But at the same time, we are also engaging with those institutions, agencies, and philanthropies that purchase significant amounts of vaccines for the continent to start with the procuring from Africa before they procure from elsewhere. We know that this is a journey. We have started it. We are very comfortable with the pace, and we are quite confident that every player in this particular health security space will see the huge advantages that exist when it comes to securing manufacturing capacity for all health products, including vaccines, here on the continent of Africa. And finally is the advocacy that we need to do with the rest of the globe. That when Africa is saying we want to do things on our own, it doesn't mean we want to do it alone. And it doesn't mean that it is only us who are going to benefit. A secure Africa, where health security is concerned, results in a more secure world in terms of health security as well.
Well, thank you so much, Dr. Ahmed, for these insights into Africa CDC's vision for the coming years. So now we will move on to our panel discussion. And I'm pleased to introduce our speakers for today's panel. Please join me in welcoming Dr. Fiona Braca, who is Regional Emergency Response Program Area Manager at WHO's Office for Africa, Dr. Paul Gwakum, who is the Regional Health Advisor for UNICEF in Eastern and Southern Africa, Professor Francesca Mutapi, who is a professor in global health, infection and immunity, and co-director in the Global Health Academy at the University of Edinburgh. She also serves as the deputy director of the Tackling Infections to Benefit Africa Partnership. And we are also joined by Dr. Gitinji Gatahi, who is the group CEO of Amref Health Africa. And finally, Dr. Nora Abudho, who is the East Africa Program Director for Women Lift Health. Thank you all so much for joining us. Dr. Braca, I will start with you first. I had read a staggering statistic that WHO Africa responds to more than 100 public health emergencies every year in the African region. What are some of the key gaps when it comes to the continent's capacity to respond to emergencies?
Thank you, Sarah, for the opportunity, and greetings to my fellow panelists. We are happy to be part of this important conversation. Indeed, as you say, Sarah, it's a staggering statistic. The African region reports the heaviest burden of public health emergencies compared to the other regions globally. On average, we receive 2 to 3 reports of acute emergencies every week from member states. And these emergencies often overwhelm already stretched health systems. They interrupt essential health services, and ultimately they fuel socio-economic disruption. We do acknowledge that there's been significant progress to try and address some of the gaps that I will share over the past few years. Countries are being guided by global, regional, and country frameworks, including international health regulations, national action plans for health security, and others. But most countries in the region continue to struggle with fully implementing these frameworks. There are several gaps. I will highlight 3 major ones. One relates to workforce for emergency response. The availability and the agility in deploying technical support immediately an outbreak is confirmed or declared is a constraint that affects the effectiveness of response in most countries. The last joint assessment that was done of the international health regulations in 2019, pre-COVID, in all the member states highlighted that only 4 countries in the region had sustainable capacity for emergency human resources. Another gap that we are seeing is around logistics and supplies for response. There are limited stockpiles available on the continent, and this further exacerbates response time when emergencies are declared. In addition to that, we have logistics hubs, some logistics hubs that serve the continent present in countries outside the continent. And so by the time the supplies are shipped and dispatched to the field, we lose time, and this affects the effectiveness of response interventions. And the third major gap we see is around coordination, and particularly at the national and the sub-national levels. We all have acknowledged that a multi-sectoral coordination at the right level of authority using a One Health approach is really important in how we address emergencies. So countries are at different levels in terms of effective coordination, and this is a key factor for effective response. Underpinning all of this is sustainable and predictable financing for preparedness and response to emergencies, which is also an issue that still needs to be tackled.
Dr. Gwakum, I'd like to turn to you. What are some of the critical areas that we must focus on and invest in to build resilient health systems in Africa that can deliver quality primary care and protect against future pandemics?
Yeah, thank you very much, Sarah, and I'm very pleased to be part of this very important discussion. I think, as my colleague from WHO says, if you don't invest in health systems, weak and fragile health systems have always struggled to respond to the effects of health emergencies and pandemics such as COVID-19, which we are living through now. And this will lead to erosion of the few gains that has been accumulated over the years. To avert this fragile situation that leads to erosion, governments have to build resilient systems that can withstand shocks due to hazards. And health system resilience is directly linked to governance. It depends on the choices of governments and communities. What type of investment is made for healthcare delivery? For us at UNICEF, our priority is primary healthcare. This simply means investment has to be made to ensure that the preventive, promotional, and curative services are brought to the community, to the children, as close to them as possible. This means the communities are engaged. This means community health workers are identified, they are trained, they are deployed, they are paid, and there are systems to be able to monitor what they are doing in the communities. The other health workers need to be identified, deployed, and also motivated. And I think if we don't have supplies, we cannot move forward with any response, be it routine or emergency. So we need to have a system for procurement of medical supplies and commodities. But all this depends on one thing, which is financing. So we think governments need to put domestic funding into healthcare. We all know about the different declarations that have been made on the continent. For example, the Abuja Declaration, whereby governments committed to put on the table 15% of budgets for healthcare delivery. In Eastern and Southern Africa, where I am kind of focused, only 2 out of the 21 countries have put something nearing to 15% of their budget for healthcare delivery. We need to have systems for surveillance to be able to identify hazards in advance and respond on time. In addition to this, I think there are issues that we need to take into consideration, multi-sectoral collaboration, because healthcare is not just about absence of disease, as we all know. It's a state of complete social, physical, and mental well-being. Things that are linked to poverty, things that are linked to child marriage, gender-based violence, urbanization, and other issues linked to water and sanitation, nutrition, has to be taken into consideration if we want to build robust systems. So in a nutshell, I think for a resilient health system that is going to be able to deliver before, during, and after hazards, in as much as the health sector takes the lead, we need a whole of government and whole of society approach. Thank you very much.
Thank you. And now, Professor Mutapi, your research and work on infectious diseases in Africa has helped empower policymakers to design policies and programs that are rooted in evidence. From your experience, what are some of the learnings that could help prepare the continent for future disease outbreaks?
Great. Thank you very much. This is an area I'm passionate about, so I like the question. So one of the big things that are patently obvious is that the time to prepare for outbreaks and pandemics is in between the outbreaks and pandemics, not during. We now have time to do something to prepare for the next challenge, which there will be a next challenge, and it won't be necessarily COVID. So I'd like to give you an example of how you prepare with foresight in response to what the continent needs. As you mentioned in my introduction, I am the Deputy Director of TIBA, an Africa-led partnership. And the importance of TIBA is that it's Africa-led, which means that we respond to the needs of our colleagues in Africa. And in 2018, after a situational analysis, it was decided that we really needed to equip our partners with the ability for real-time viral genomic sequencing. So I was really pleased to hear our colleague from Africa CDC talking about capacity and the previous speaker talking about surveillance. So what we did then was we trained all our partner countries on real-time genomic sequence with a very specific approach. We trained, we equipped, we supported them, and then we shared the data. So by the end of 2018, all our 9 partner countries were capable of sequencing in real-time viral genomics. Come 2020, COVID arrives, and all those African countries were able, as the research scientists, to do the sequencing. And what was particularly important was that their governments immediately realized the importance of this sequencing and nationalized the programs. So they put a lot of funding in there and equipped their scientists in order to generate data and information that could inform the national government's policies. So countries like Ghana, Uganda, Kenya, Botswana, Rwanda were all able to sequence and generate sequences for SARS-CoV-2 in their own countries. Countries like Rwanda had never done this before. They would normally send off their sequences. And this is a capacity that is really fantastic. And if we can build on that and now do our situational analysis of where else do we need this capacity, and the capacity has to be homegrown, home supported, and respond to the needs of the countries.
Thank you. And Dr. Katahi, COVID-19 has driven important conversations about strengthening public health response across the African continent, including prioritizing vaccine manufacturing to limit outside reliance. How can African countries transition to a position of self-reliance in the health space?
Thanks, Sarah. And I would like to say that this is not an ordinary conversation. And I think we should not handle it as an ordinary conversation. And let me just reflect on that, because I know that all the colleagues here have commented on these issues, and also the Director of Africa CDC has commented on this. The lessons we've learned are not only from COVID, the lessons are structural. We have structural challenges that COVID just brought to the fore. If you look at Ebola 2014, we had these webinars talking about how Africa can rebuild itself and become self-reliant. But we still ended up with major challenges during COVID. More recently, we've seen the cases of monkeypox, where Africa has been battling this since 1970, but there has been completely no focus on it. Countries have been battling it, with WHO Afro, with Africa CDC, countries on their own, and has not been seen as a global threat until some cases of monkeypox or suspected cases of monkeypox found themselves in Europe. In the HIV era, we found that, again, it was not until civil society went on the streets and made demands that there was any attention paid to this. This is a moment for us to say this is no longer an ordinary conversation. And where I'm heading with this is to say that what Africa needs is not just self-reliance, because self-reliance says, there is some form of external control. It is actually mutual partnerships. It's about equal partnerships, mutual partnerships, peer-to-peer partnerships, not for Africa to be seen in the global health arena as those people. It has to be part of the entire global health. And I think it's Ahmed who said about Africa is not clamoring to be healthier so that Africa is healthier. It is so that the world is healthy. So Africa must be seen that way. So I would like to say that the way to move towards this is for Africa to be self-directed and autonomous within the global infrastructure. Not that because we are doing things on our own, we do them ourselves, we do them on our own, as Ahmed said. So it is important for us to consider this and not an extraordinary conversation for the future. Now, there are certain things that Ahmed talked about. The first thing is the new public health order. Based on the things I've said around monkeypox, Ebola, COVID-19, it is important that Africa has ownership of its health security. The reason I'm calling out for that is because Africa is dependent, of course, on maximum respect to the WHO and to the international health regulation and everything, and Africa upholds the principles of IHR. Africa must also be able to be in control of when the IHR triggers are important. Not when Europe decides the IHR is important, but Africa must also decide when the IHR controls and responses are important, because we've seen that they're only important when the diseases go outside Africa. This is not an ordinary conversation, Sarah, I'll repeat. So the thing to say, Africa needs to uphold the new public health order. Of course, this will mean that Africa strengthens the Africa Centers for Disease Control, strengthens its pandemic response, strengthens its mandate on the African governments for this IHR control. Because right now, the African governments, as was said earlier by my colleague Fiona, very few of them have actually put the core capacities to manage IHR. but they're individual countries, 54 of them. What power can there be if they actually had a common mandate at Africa CDC to uphold IHR, to build core competencies together to respond to the global need of IHR? But ownership and autonomy within Africa is important, which is why, as Africa CDC, as the Commission for COVID-19, we have asked for a development of the Africa Pandemic Preparedness and Response Authority, not to challenge IHR, but to complement IHR and to ensure the African country capacities are built to support IHR, but with the mandate of Africa CDC to ensure that Africa countries drive towards that goal. The next thing to say is that Africa is needs to be part of the global supply chain. When we talk about Africa vaccine manufacturing, some people see it as if Africa therefore wants to manufacture vaccines for themselves, and therefore it becomes a tokenism thing. Let us go help Africa build a factory so they can now manufacture vaccines for themselves. And when they manufacture vaccines for themselves, because they're not considered as part of the global supply chain, those manufacturing sites fail. We've seen Aspen in South Africa. Oh, you have a factory, please do what you want to do. We have to be part of the global supply chain, just like India is, like Europe. So we must not look at this as Africa wants to feed itself, Africa wants to do this and this. And this is why I'm talking about mutual partnership, not just self-reliance. The next point is, I think the other points were elaborated by Ahmed, the market shaping, the regulatory framework, R&D investments in Africa, which have to come to what Paul was saying about more investments in health, because R&D will be part of health financing. And maybe finally, just to say that all this has to be built around one health system, not a health system for emergency response and a health system for essential services, but one health system that is resilient enough to respond to emergency, but also optimal enough to provide for health services as essentially demanded by its people. I just want to comment on something that was said by, I think it's Fiona, about the stockpiles. This is the issue that I talked about of Ebola, monkeypox, and all this. We currently have stockpiles of Ebola in Geneva, waiting for an Ebola outbreak in Europe or North America, yet countries in Uganda, in DR Congo are dealing with Ebola every day. Does 2 cases of Ebola in DR Congo or 5 or 10, are they less of a health emergency than 1 case of Ebola in Europe? And where do we have stockpiles of these vaccines elsewhere, but the frontline health workers and volunteers who are responding daily and where the cases actually are live cannot access the stockpiles until the cases go out of Africa? So even when we discuss this, we must also talk about commodity security, responsiveness, emergency, and the stockpiling closest and most proximal to where the health emergencies are likely to emerge. I submit.
And so thank you so much for that. Dr. Abudo, responding to the inequalities that have been exacerbated by COVID-19 means reinvesting in the fight against other deadly diseases such as HIV, TB, malaria, and polio that continue to disproportionately affect people living in poverty. Can you speak to the importance of the public, private, and philanthropic sectors working together to invest in quality health services for all and prioritizing ongoing epidemics like HIV, TB, and malaria?
Thank you very much, Sarah, for that question. And I think it's a very important thing because we have seen the importance of the public and private sectors and the philanthropic sectors coming together to address health crises that develop. But again, this is not the first time this is happening. We had it as well with HIV. It's been happening. That coordination has been happening to support a crisis, both in the global north and the global south. However, I think what we end up finding ourselves in is what we call the panic neglect cycle. Such that, in what Dr. Githinjas just talked to is when it's an issue in the global north, when it touches it, then there's a lot of seriousness. We all, hurry up, put money together, create a facility of sorts. We come in and deal with the issue. And then when it is over or seemingly under control in the global north, then it's not an issue anymore and the support ebbs away. And this is at risk of it, of course, recurring in the areas. So we do not take care of the recurrence or resurgence of this issues that come at hand. And the second thing that I want to bring out is that we should not be redirecting from what is already what we are addressing. HIV has been there all this time. TB has been there. Malaria, why should it suffer? But it has suffered because we had to redirect resources. We had to, overwhelm a health system that was already just struggling to provide basic services. But why should that be? And it's just showing us that really, if we're going to talk about equitable services, we must invest in health system strengthening. And with health system strengthening, then we can surely achieve universal health care. And there's no other way in which we can manage all this pandemics and already what is existent without supporting the health system. So at the end of the day, we might redirect for immediate management. We might, again, reinvest in TB and reinvest in malaria, reinvest again in HIV. But is this cycle going to stop? What is going to stop this cycle? And it's just how we're going to focus our focus on emergency preparedness. That is a subset of a resilient health system. We must be prepared. We must not pull back when we feel that things are okay in the global north. We can redirect that money when we do feel that things are in control to support the health system to continue. The only way we can achieve this is also integrating all these things. Why should we be looking at the silo approach, the vertical funding approach that we have been employing as we address illnesses that are affecting the region? So my call really is that when we have all these sectors, we must have a multi-sectoral approach. I think we have spoken to that. When we work together, then we are able to prioritize our issues. We're able to pool our resources. We're able to target these resources appropriately. And then, of course, redirect back to strengthening the health systems as well. And at the end of the day, health systems and ensuring that our health systems are working and global health security, they're all synergistic. They all complement each other. So there's no one who's going to lose by focusing on global health security and health systems at the end of the day. We all win. But we must make sure that we are secure in Africa. We must focus on our own capacities and push on that and ensure that Africa is one and using one health system. Thank you.
Thank you. And Dr. Braca, WHO's Office for Africa has just launched 3 flagship programs to support member states in the African region to adequately prepare for, detect, and rapidly respond to health emergencies. How will these programs address the gaps that you spoke about previously? Kind of what sort of changes should we expect in the way that the African region approaches emergencies moving forward?
Thank you, Sarah. The 3 flagships are an effort to try and pull together several lessons that we have learned over the years in preparing for, detecting, and responding to emergencies in Africa. And it also is, they are a reflection of the dozens of recommendations, over 300 recommendations that have been put forward by independent bodies that have assessed the global response to the COVID-19 pandemic. The initiative, the first one on preparedness, is looking at ensuring all member states are better equipped to plan for health emergencies and humanitarian crises. And within that initiative, we're looking at provision of technical assistance to countries for developing national and subnational level emergency preparedness plans that address all hazards, that address continuity in provision of essential health services, and that align with the One Health approach in a coordinated and holistic manner. It also looks at local and regional supply chains. A lot has been said by other speakers on this, and really trying to enhance the availability and the distribution of life-saving health commodities in Africa. Also looking at rapid financing mechanisms for response and recovery efforts after the shock events, looking at global equity in access to life-saving interventions during an emergency. The second flagship addresses detection, and here we are really aiming to support member states to strengthen surveillance and lab capacities for quicker detection and response to public health threats. So within the integrated disease surveillance and response framework, how we can really accelerate implementation and support countries to have those systems in place, how we can modernize data acquisition, analytics, technology systems for robust detection and quick action, and also how we can scale up event-based or community-based and surveillance and genomic surveillance activities in the region. The third flagship is around response. And here we are really looking at making sure that governments are equipped to mobilize and to respond to public health emergencies within the first 24 to 48 hours of confirmation or declaration of an emergency. That period is very critical, and it is where we have a big challenge. We've talked a lot about making sure that the vast trained human resources. We have several initiatives on the continent to train the human resource for emergencies. So what we're looking at is really making sure that they are rapidly deployable and interoperable when the emergencies occur. Also looking at the coordination of the response at the national and the subnational level, addressing operations and logistics, and also facilitating risk communication and community engagement to really make sure we convey public health threats transparently in a timely and a coordinated manner with community. They are also engaged in matters that relate to their health. Underpinning all these flagships is partnership. The leadership and collaboration with member states is paramount. Partnership with regional entities such as Africa CDC, WAHO, SADC, and others to drive this forward will be important. We are partnering with Africa CDC to integrate the response flagship under the continental umbrella of the Africa Volunteer Health Corps, AVOC, which is a continental initiative also trying to address a workforce for emergencies. In terms of impact that we can expect in the way the African region approaches emergencies is that we expect that governments in the region will be better capacitated to detect and to respond swiftly in a coordinated and inclusive approach, that the leadership for addressing public health emergencies will be elevated to the highest political level for advocacy and investment of the necessary domestic resources to better prepare for and respond to emergencies, and above all, that communities will be engaged and they will be compliant to the recommended public health measures. So this is our thinking around the future, and really looking forward to partnering with the several partners in this platform, but also across the continent to take this work forward. Thank you.
Thank you. Dr. Gwakum, COVID-19 disrupted immunization programs in many countries and put many communities at risk of disease outbreaks. What structures can be put in place to ensure immunization services continue even in emergencies?
Yeah, thank you very much, Sarah. And this is a very pertinent question as we are battling with a couple of vaccine-preventable emergencies in Eastern and Southern Africa. And we always hear in speeches, immunization is the most cost-effective intervention in public health, which is true, but we have to walk the talk because disruption of immunization due to weak health systems, due to societal obstructions or other emergencies often lead to these outbreaks. And to ensure immunization services continue to be delivered, especially during emergencies, we must build resilient systems. And I think each and every one of these panel has talked about health system strengthening. We need to build resilient systems for routine immunization by doing the following. I think governments have to make sure that they craft policies and plans and strategies captured in multi-year plans to be able to reach the target population, especially what we call today the zero-dose communities. Governments have to have information on who needs to be vaccinated and where are these children, where are these people who need vaccination. And based on this, they have to support decentralized planning, micro-planning, to be able to define the approaches that they need to be able to reach this target population, which may be fixed, outreach, or mobile approach. And there need to be supplies, and that takes me back to what I was talking about, financing. Government should be able to procure the vaccines, especially the traditional vaccines that are not supported by Gavi, to make sure that we don't have stockouts. Stockout of measles vaccine, for example, means unvaccinated children. Unvaccinated children will lead to outbreaks. But above all, we need to commit or involve the community, engage the community, because if you have vaccine objectors, it's because they have certain things that only the community can help us to be able to take forward. We need to have platforms for periodic monitoring for action to be able to identify bottlenecks on time and resolve them. All these are approaches already known and proposed by UNICEF and WHO, but it needs to be operationalized and taken to scale by the different countries. But during the emergency itself, for example, during the COVID, we have to profit and do what we talk all the time of humanitarian development nexus. The additional resources made available during COVID can be used to strengthen the system. For example, build a cold chain. For example, reinforce the information system, digitalize the system so we have real-time information for action. We can also use these resources, for example, to be able to build primary healthcare systems at community level to be able to deliver not only immunization, but other essential services. So I think, in a nutshell, we have to build systems that are operational, that can deliver, that can resist when we have hazards and continue to deliver, or else any disturbance or disruption of essential services, especially vaccination, will lead to what we are having today, outbursts of vaccine-preventable diseases. So thank you very much.
And Professor Mutapi, the COVID-19 pandemic has set us back in achieving elimination and eradication targets for many neglected tropical diseases. Aside from addressing resource constraints, what can countries and partners do to help end NTDs and ensure they maintain progress even during moments of crisis?
Great, thank you. So we'll start with the lowest hanging fruit. I think my colleague, Dr. Gitari, was with us in Kigali a few weeks ago when a high-level innovation was put to the table. It's basically the Kigali Declaration on NTDs, which is calling on government stakeholders to support the various strategies, the various aims of the WHO and the UN for their SDGs to eliminate, control, and eradicate some neglected tropical diseases. Now, several African heads of state were there. They signed this declaration. So my first suggestion would be, let's honor the pledges they made to control, eliminate, and eradicate NTDs. Also present were pharma, stakeholders and funders such as Melinda Gates was there, and they pledged to support countries in their efforts to control the NTDs. So my call to them would be to please honor your pledges. We know, and I know that DevEx has already run a piece on this earlier this year, of the unilateral withdrawal of the United Kingdom from their pledge they made in the predecessor of the Kigali Declaration. They withdrew in 2021 £150 million, which was 90% of their commitment to the NTD budget, unilaterally. And this meant that over 250 million people did not receive their treatments, and over 180,000 surgeries did not take place. So it is really important that this is not just a paper exercise. Everybody who was involved in the signing of this delivered on their pledges. We also ask that the several African governments and international stakeholders and African philanthropists who have not yet made this pledge and have not made any contribution to NTD control in Africa do that, because only then can we reduce the burden of NTDs on the national health system so that they can focus on other things such as surveillance for other pathogens. The second thing, which is the elephant in the room, is that NTDs proliferate because of poor water and sanitation structure on the African continent. This is not of no interest whatsoever to the Western funders because it is not in their backyard. But African governments have taken the leadership by signing the Kigali Declaration of NTD control on the African continent. We need to be serious about addressing WASH. I'll link that to why this is important, not just for NTDs, but also for any outbreaks and pandemics. We all know of the G7's pledge that whenever we have a new threat, they now want us to move to new innovations, interventions within 100 days. We know very well this is not going to be the case for Africa because we know we've learned from HIV, the 10-year wait for antiretrovirals on the continent, that these innovations will take time to get to Africa. And even in Africa, they'll take time to deploy. The thing that is going to save Africa is good public health. And at the core of public health is water, sanitation, and hygiene. So these are really, really critical because as we saw in the West, it was also good public health that saved us the first year of the pandemic. So let's kill many birds with one stone by improving our WASH infrastructure on the continent. Thank you.
Dr. Gitahi, delivering universal health coverage is a challenge for many African countries, which has been exacerbated by COVID-19. As countries refocus national health priorities, what can be done to advance health for all and ensure quality healthcare and essential services are accessible for everyone?
Thank you, Sarah. As the other colleagues have talked about, and just speak from the last point of Francisca, and even when Paul was speaking, we know the health system building blocks. They are well understood. So the answer to your question is actually invest in the health system building blocks. But it's not as simple as that. So let me try then and say, how do we actually overcome these challenges? We know that for UHC to be achieved by African countries, we are talking about access to needed health services. And those include the entire spectrum, including sexual reproductive health and rights, NTDs and everything else, including family planning, which is a really critical health service. The next thing is all these services need to be of optimal quality. When I talk of optimal quality is that Africa must not try to duplicate excellence from the West that have more tertiary and secondary care, but must look at optimal, where optimal says desired outcome for a mother and child, for example. If you have a healthy mother and a healthy child, that's good enough. So if you have only the paper-written pathogram to monitor the mother and child and have the good outcome, that's good enough. You don't need wired monitors on the wall. So basically optimal quality, which is affordable. And the final point, of course, is the affordability, which is the financing. Now, Paul did reflect on the financing challenge we have across the continent. Very few countries have achieved 15%. Actually, very, very few. Across the continent, I'll be surprised if there are more than 4 or even 3. Very few of them have achieved the needed per capita or GDP percentage, or even achieving what WHO says you need between $80 to $100 per person for you to actually provide basic health services. But the challenge is very big, Sarah. The challenge is fiscal space is very low. Countries, Africa, 17% of the population, with 23% of the global burden of disease, but with only 2.7% of the global GDP. So there's a fiscal space challenge. So then the next question to ask is, since Africa really is going to find it very hard in the next few years to achieve $100 or $80 per capita on health from public money, it means between now and then, we must do several things. And I know we don't have much time. One thing we need to do is focus on equity, efficiency, and those two reflect the word choice. We must choose the people to focus on. That means equity, the most left behind, women, girls, and the most vulnerable. That's a choice governments have to make. Secondly, is that even when we choose them, we also have to be most efficient in where we put the money. Where do we put the money? Do you put the money in high-level cancer care with, I don't know, whatever it is, or are you going to put it in family planning, sexual reproductive health, pneumonia, malaria control? So choices on what you're going to invest in. And then out of that, to actually choose health promotion and prevention. Because eventually, it is health promotion and prevention through the primary healthcare model of empowered communities and multi-sectoral approaches, which mean climate change, reduction of sugar consumption, reduction of smoking, reduction of consumption of negative fats. It is that's going to save our little money to be able to do proper primary and secondary care in future. So that's what I would say, that it's choices that Africans have to do until, at the same time, increase the fiscal space, increase contribution to health, and then we achieve this slowly by slowly over time. Thank you, Sarah.
Thank you. And Dr. Abudo, during the health emergencies, resources are stretched and women's health services are often the first to suffer. What can governments and development stakeholders do to ensure women have access to essential sexual and reproductive health services at all times?
Okay, thank you, Sarah. And I think in the interest of time, it has been emphasized. It's about the health system strengthening. It's about prioritizing, as Dr. Gitahi has mentioned, because we can't do it all within the system blocks. But in addition is that we can look at, countries enacting, laws and policies that ensure that there's access to these services, to sexual reproductive health services and information by women. But again, we can have all these products on the shelf. We can have the contraceptive products and information. It can be available, but the women are still not using it. And I think that comes from, the ability of women to exercise decisions over their body. And I think from the UNFPA, they had a survey that they did across 51 countries. And we find that a quarter of the women are not able to exercise decisions on even accessing healthcare services. So I think also encouraging interventions that will support, whether it's communication and information that's provided to women, girls, and children should be available, and also support of research and programming that that support innovative interventions like self-care for women and children to be able to, and adolescents and young women to be able to access these services. So I think these are areas that we can look at. And in addition, having an engendered approach in our responses. And this means that we must have at least women represented in the medical hierarchy so that we have more balanced decisions for women's reproductive health. So I think having both women and men represented in the decision-making table will be valuable in ensuring that we move the reproductive health agenda and that we are able to continue with services even in calm and in crisis. Thank you. Over to you.
Thank you. And now we'll take, we're almost out of time, but we'll take some quick questions from the audience. First question is, please can you provide some recommendations to address the hesitancy among the frontline health workers? Would anyone like to take that?
Can you repeat the question, please?
Sure. Please, can you provide some recommendations to address the hesitancy? I believe the question speaks to vaccine hesitancy among frontline health workers.
Yeah, I think I may come in here. In the response to COVID, we have different interventions, and we have risk communication and community engagement, and social behavior change communication, which tries to identify the determinants of objection, or why do some people refuse to have access to certain health services, especially immunization. And I think our social behavior change colleagues, they do go in depth to be able to find the sociocultural determinants to be able to use this to convert the objectors to acceptors. And there is no one single answer from one community to the other because the drivers may be different, but you need a focused analysis to understand what determinants to be able to overcome this. Thank you.
Thank you. And we'll take one question, the last question quickly because we're just at time. But Dr. Gatahi had mentioned some strategies around this before, but I'm wondering if anyone else has any thoughts on how do we get the political leadership to invest a minimum 15% of their annual budget on health as contained in the Abuja Declaration with a keen focus on primary health.
Yeah, I can comment on this very quickly that I have engaged with many government ministers of health, a few presidents, not many. I don't have that much access. And they always ask, what is investment in health? I think what we measure tends to be what is budgeted for the Ministry of Health. But many of the heads of state say, what about education? What about water and sanitation? What about investments in nutrition? Are these investments in health? So whereas we want the budget to a health sector to go to 15%, and we have to push for that, in very low fiscal space, we are then asking, so should it be at the, for example, should 15% of health budget be at the expense of education of girls? In which case, then you have less absorption of family planning. Or should it be, or should you actually start looking at water sanitation, as was said earlier, on NTDs? Should you start actually looking at water and sanitation and hygiene as an investment in health? Or are we only looking at curative services? So I think it's a more complex question. It will be easy to, from an advocacy point of view, to say we must push government to achieve 15%. But then when you look deeper at the economies of Africa, then you have to ask how do you make the choices? And that's why I'm talking about choices on prioritizing the focus populations, the one equity, the term equity, and secondly, what set of services are you going to prioritize that give you the biggest return on the little dollars we have? Not negate the 15%, but to explain the complexity around it.
Yeah, I may want to comment, Sanji. I think you're very right, and 15% may not be the ultimate goal. We need to have allocative and operational efficiencies. For example, if you don't prevent the case of HIV, what happens? You will end up treating the case for the next 5 years or till the person dies, depending on the lifespan. That is expensive. So governments have to have choices within the limited resources. What do you want to prioritize? And that's what I said in my presentation before. You have to prioritize primary health care. I'm not saying the other levels of care are not important, but if you want to have dividends, you prioritize what is going to give you the best of returns and value for money.
Thank you so much. We're unfortunately coming to a close of our discussion, but as our esteemed panelists outlined, countries across the African continent are amid significant shifts in the way that they manage public health. Our speakers spoke about what the future of health system strengthening should look like in the years to come. And this includes a vision towards expanded local vaccine manufacturing capacity, stronger public health institution, integrated services, strong primary health service, and universal health coverage. That it's time to integrate longer-term COVID-19 management into health systems and to double down on managing other epidemics that have lost ground in recent years, like HIV, TB, and malaria. So thank you so much to our speakers for providing us with a roadmap for moving forward. And thank you to all of our guests for tuning in. We really appreciate your time and look forward to collaborating in the future with all of you on health system strengthening.
Thank you.
Thank you.
Thank you.
Plato said, "Who will guard the guardians? Who are our guardians? Do they care about us? Are they accountable for their actions, or are they above the law? Who elects these guardians? Us? Them? Someone else? And if they guard us, Who will guard them? Who will guard the guardians? The Malin Guardian. If you